Hello everyone, welcome to Easy Vet Anatomy. I'm Dr.KP Sharon, and in today's video I'm going to explain about the radius and ulna of different species. So let's get into the video. First we'll discuss about the radius of ox species. So radius is a long bone. It is larger and shorter than the ulna. It is a bone of the forearm region, and if you see the location, it is placed obliquely downwards between the elbow joint above and the carpal joint below. And between the two bones means it is between the distal extremity of the humerus and the proximal row of carpals, forming elbow joint and carpal joint above and below respectively. And it has a shaft. So this bone is the radius bone and this is ulna bone. We talk about the radius bone is having a shaft and two extremities. So this is the shaft, proximal extremity and distal extremity. The shaft, it is flattened from before backwards. So this shaft, it is flattened and it has two surfaces. This surface is dorsal surface and this surface is olar surface. So this one is olar and this one is dorsal surface. The dorsal surface is convex in its length. So you can see it is convex in its length, smooth, and it is covered by the extensor muscles of carpus and the digits. Whereas the olar surface is somewhat concave and it presents along its lateral border. Coming to the border, see here, this border is the medial border and this border is the lateral border. The olar surface in its lateral border, so it contains a rough area. So you can appreciate here there is a rough area for the attachment with the ulna. Radius and ulna, they are attached by a ligament called as interosseous ligament. So this rough area, it is interrupted above and below by two smooth areas. You can appreciate these smooth areas which is forming proximal radio-ulnar arch and distal radio-ulnar arch. These two arches, they are connected laterally by a groove called as radio-ulnar groove. So this groove is for the passage of the interosseous vessels. Coming to the medial border, so this border is the medial border. The medial border, it is rough in the proximal part for the brachialis muscle and also for the attachment of medial ligament of the elbow joint. And in the lateral border, so this is the lateral border. In the lateral border, in the proximal third, it is wide and flat, and here you can appreciate the radio-ulnar groove. So this border, it gives the attachment to muscles like lateral digital extensor and the extensor carpi obliquus. Next, coming to the proximal extremity of the radius, so you can appreciate two articular surfaces, the medial articular surface and the lateral articular surface. It is divided by a groove, sagittal groove. The proximal extremity, it is divided by a sagittal groove into two articular surfaces where the medial one is large. If you remember the distal extremity of the humerus, the medial condyle is comparatively larger than the lateral condyle. The medial condyle of the humerus, it will articulate with this medial facet present on the proximal extremity of the radius. And there is a small facet for the in the proximal extremity of the radius for the distal extremity of the humerus, especially the lateral condyle. And you can appreciate the rim here. So at the middle of the rim, in the anterior face, it is having a process. This process is called as coronoid process. This coronoid process, during extreme flexion, it will go and fit into the coronoid fossa. If you remember the distal extremity of the humerus, there is a coronoid fossa. So in that coronoid fossa, during extreme flexion, so this will go and fit, coronoid process. And if you see on the posterior aspect, there are facets for the ulna articulation. So here you can appreciate the facets for the ulna. and there are two tuberosities here. So as this is ulna, which is attached towards the lateral borders, this is lateral side. So here you can appreciate a tuberosity. This is lateral tuberosity. And one more tuberosity which is present on the medial aspect of anterior face. So this part is called as radial tuberosity or medial tuberosity. In case of ox species, the lateral tuberosity is more prominent. Okay. So this medial tuberosity is for the insertion of the biceps brachii muscle, and this lateral tuberosity, it gives attachment to lateral extensors of the digit. Next, coming to the distal extremity. The distal extremity of the radius, it is somewhat wide and it is having three oblique facets. One for the radial carpal, one for the intermediate carpal, and one for the ulnar carpal. So as you can see here, this is radius bone, this is ulna bone. The ulnar carpal, the articulation for the ulnar carpal or the facet for the ulnar carpal, it is partly furnished by the ulna and partly by the radius. On the medial and lateral aspect, so this part, this is the medial and this is the lateral aspect, there are rough elevations for the collateral ligaments of the carpus. Okay. Next, we'll discuss about the ulna. So ulna, it is a long bone. It is longer than the radius and it is situated on posterolateral aspect of the radius. So it is fused with the radius except at two parts. So at this and this part, where they form the interosseous spaces, proximal interosseous space and distal interosseous space. The shaft, it is complete, it is three-sided. So whatever the surface you are seeing here, this is the dorsal surface and this is the lateral surface and this is medial surface. It is having three surfaces. The shaft is three-sided. The dorsal face, so this face, it is rough except at two places where it is smooth and it is applied to the ular aspect of the radius. And the medial face, it is wide. So this face is the medial face which is wide, and the lateral face, it presents a radio-ulnar groove between it and the radius. Okay. Coming to the proximal extremity of the ulna. So this is the proximal extremity. So this forms the major part of a bone and it contains a semilunar notch, anconeus process and olecranon process. So this olecranon process, which is larger, it is quadrilateral in shape. It is directed upwards and backwards. So if you see this bone, this is the lateral surface and this is the medial surface. The medial surface is somewhat concave. Medial surface is concave and lateral surface is convex and rough. The anterior border, so this border is the anterior border. The anterior border bears on its middle a pointed projection. So this pointed projection is called as an anconeus process. This is for the anconeus muscle. This anconeus process, during extreme extension, it fits into the olecranon fossa of the humerus. If you remember the distal extremity of the humerus, it is having an olecranon fossa. Into the olecranon fossa, this anconeus process, it will articulate during extreme extension. And this is called as summit of the olecranon process. This summit of olecranon process, it forms the point of elbow and it gives the attachment to triceps muscle. And the semilunar notch, which is placed below the anconeus process, it will articulate with the posterior part of medial division of the articular area of the humerus. If you remember the medial condyle, it is divided by a sagittal groove. So this groove, it will extend into the olecranon fossa to fit into this semilunar notch. Coming to the distal extremity, it is fused with the radius. So it projects below the level of the radius to form a process called as styloid process of ulna. So this styloid process of ulna, it bears a facet for the ulnar carpal. Next we'll discuss about the radius and ulna of horse species. So coming to the radius, we'll discuss only the differences between the ox. So same, this is the dorsal surface and this is the ular surface. This is medial border and this is lateral border. In case of horse species, close to the medial border of the ular face, Below the middle, there is a rough elevation. So this is for the radial check ligament. And coming to the lateral border, so this border is a lateral border. It presents only one smooth area. So as it is forming a single radio-ulnar arch, only proximal radio-ulnar arch we can see, it is forming the proximal interosseous space, whereas the distal interosseous space is absent, as the ulna is extend only up to the 1/3 of the radius. So it forms only proximal interosseous space. Here the tuberosities. So this is the radial tuberosity or medial tuberosity, which is more prominent in horse species. Whereas lateral tuberosity is present, but it is not that much prominent. Lateral tuberosity is more prominent in ox species. And coming to the distal extremity, the facets for the carpals, they are less oblique, they are nearly straight. And here the lateral facet, this part, it articulates with ulnar carpal below and with accessory carpal behind. And you can appreciate the styloid process. This is the styloid process of radius or medial styloid process. This is the lateral styloid process or the styloid process of ulna. Coming to the ulna of the horse, so it is shorter, reaching only the distal third of the radius. It forms the proximal radio-ulnar arch. And there is no articulation with the ulnar carpal, as it is extending only up to the distal third. It is not having any articulation with the ulnar carpal. Ulnar carpal articulates with the lateral facet of the radius. Next we will discuss about the radius and ulna of dog. The radius and ulna of dog, they are relatively longer and articulate with each other at their extremities. So this is proximal and this is distal extremity, leaving a narrow interosseous space. So you can appreciate the space, narrow interosseous space in the middle. So these, they pertain certain degree of the movement at the proximal and the distal extremity. If you see the radius, the proximal extremity of the radius is small and it bears a concave facet for the articulation with the humerus, and posteriorly it will bear a facet for the articulation with the ulna. The distal extremity is comparatively wider. And here the medial border, it projects a process. So this process is called as styloid process of the radius. And laterally there is a concave facet for the ulna. Next we will discuss about the ulna in case of dog. So ulna, here it is well developed and crosses the ular face of the radius mediolaterally. So this is the medial side. And here you can appreciate in the distal extremity lateral side. So it is crossed mediolaterally, enclosing a narrow interosseous space. So if you appreciate the olecranon process, the olecranon process is grooved here. Okay. So because of this groove, it shows three prominences. First one, second one, and this is the third one. So anteriorly it shows two prominences and posteriorly it shows one prominence. So among these three, the posterior one is larger and rounded. Below the semilunar notch, this is the semilunar notch, this is Anconius process. Below the semilunar notch, so there is a facet, concave facet, which is for the radius. And if you appreciate the distal extremity, it is having a styloid process. So this styloid process, it articulates dorsomedially with the radius, and the distal part it articulates with, so on the extremely at the lower part, it articulates with the ulnar and accessory carpal. This is how the ulna is articulated with the radius. So it is projected mediolaterally. And see here the styloid process, it is articulating dorsomedially. Next we will discuss about the radius and ulna in fowl species. So the bone which is slender, this is radius, and the one which is thicker and bent, that is ulna. The bones of the forearm, they are nearly parallel to the humerus. So of these two bones, which is thicker, ulna is thicker and radius is slender. They articulate at each ends, so at the proximal and the distal ends, leaving a wide interosseous space. So this space is the interosseous space. Wide interosseous space is seen in the fowl species. Narrow interosseous space is seen in the dog species.
And this is the proximal extremity. The proximal extremity, it bears a concave articular area for distal extremity of the humerus. And the distal extremity, so it is flattened from side to side, it articulates with the radial carpal. Next, coming to the ulna bone, so it is larger, thicker than the radius, so it is curved in its length. So this is the proximal extremity, which is having two concave facets. So here is one and here is one. One facet is for the articulation with the humerus and the other facet is for the articulation with the radius bone. Okay. And coming to the distal extremity. So the distal extremity, it is expanded and presents a trochlea. So here you can appreciate a trochlea. This is for the articulation with radial carpal and ulnar carpal bones. And if you appreciate this olecranon process, the olecranon process is very short.
I hope this video helped you. So please do follow, like, share and subscribe to Easy Vet Anatomy. Thank you.